Hi, my name is Heather McGowan, and I'm here to discuss with you today a subject that is near and dear to my heart, and that is somatic healing, which is a body oriented therapy, and how that can be an effective tool for regulating emotions in women that experience both trauma and addiction. Somatic therapy has been studied in the last couple of decades as an innovative treatment that addresses the trauma that gets stored in the body while also integrating the mind, body, and spirit in the healing process. And so, what I aim to do in this video is examine the relationship between trauma and substance abuse in women and show you how somatic therapy can be an effective tool in healing trauma, regulating emotions, and also improving relapse prevention rates. As you can see here, trauma and addiction are both global crises, and they affect a lot of people. These numbers are pre-COVID, so more numbers will be coming up. We will see more a rise in addiction and both trauma. And trauma and substance use disorders are frequent occurrences in women, which creates a need for a more trauma-informed approach. Trauma experienced by women also includes intimate forms of abuse, such as sexual and physical abuse by a partner, and trauma that's experienced in the youth affects how people handle and react to stress. And there's a closely tied relationship between addiction and stress, and that's how, with the cortisol being released in the body, and that affects the entire body, every organ and tissue. And so, as I mentioned earlier, trauma is experienced disproportionately in women because of the types of trauma women experience, which are such as intimate forms of abuse. And women are more likely than men to experience adverse childhood experiences, and so they tend to use substances to escape or dissociate as a way to alleviate the emotional suffering or anger or stress that accompanies these experiences. And so co-occurring substance use disorders and PTSD have been shown to be related to mild deficits in emotion regulation. Besides using substances as a form of self-medicating to manage their emotions, people with co-occurring trauma and addiction have had their brain development disrupted, specifically the limbic and emotional brain, the dopamine and opioid circuits, and the impulse control and stress apparatus regions of the brain. And so it's important that further research is done on emotion regulation and how, and an understanding on how the effect of trauma contributes to negative consequences in substance use disorder patients. And these consequences include more substance use, leaving treatment early, and relapse. And so that brings us to the healing the mind and body approach, a holistic, multifaceted approach that it emphasizes reducing shame, fostering strength, resiliency, and increasing support for women is the most effective treatment in the co-occurrence of trauma and addiction for women. And it's also important for women to be able to reconnect to their body as a place of safety. As I mentioned earlier, a lot of the forms of abuse experienced by women are physical. And so it's important to foster that connection. So what is somatic therapy? Somatic therapy is, it integrates the mind and body to cultivate awareness. And it does this by removing energy blocks that get stored in the body from traumatic experiences, thus returning the body to homeostasis. And it does this by resourcing, assisting clients in developing resources within themselves, which allows them to move out of the stress response, which is the freeze, fight, flight, fawn, into a more elevated level of functioning with a clarity of mind and effective emotion regulation. And somatic therapy also integrates the mind and body to cultivate awareness. And so goal is that by doing this, the client will be able to fully engage in their lives and restore motion, regulation, and body awareness. Awareness of the body is a crucial component of somatic therapy. So, a somatic therapy practitioner may begin the session by asking the client to engage with their body fully in mindfulness. And to do so, the client needs to be in a centered, grounding state and calm. So, the practitioner may ask, where in the body are you experiencing this difficult emotion? And they may continue to ask the client to focus on felt sensations in the body by noticing the client's movements and also trying to figure out the movement the client would have instead made but could not. So, as I mentioned, centeredness is an important aspect. And by slowing the breathing, the client can also sense feelings in the body more accurately. And body work is another key element of somatic therapy, which usually involves a practitioner using their hands to manipulate their face, body, and tissues. Breath work and guided meditations may also be involved. So, what are the types of somatic therapy? We have somatic experiencing, which was modeled after Jungian therapy and the observation of animals and their instinctive ability to shake off stressful energy. And that includes body work usually as well. Hakomi method, which depends upon deep and continuous mindfulness and highlights the physical nature of how individuals experience being in their bodies. Body work may or may not be involved, as a licensed therapist directs the client's attention to their bodies with verbal cues. And sensory motor psychotherapy, and that draws upon the Hakomi principles and integrates concepts from neuroscience and CBT. And mindful awareness and body-oriented therapy involves a combination of mindfulness, bodywork, and psychoeducational methods to demonstrate interoceptive awareness, awareness of the body, and skills related to general well-being. And so there's other forms. Somatics is a broad term that involves body movement to improve mental health. So that also includes yoga, Pilates, dance, and judo, to name a few. So I hope you found this video helpful and that you can refer this to a friend that may be experiencing this, or that you may use this for yourself if needed. Thank you for taking this time.